Did you catch what the purpose of the thoughts of suicide served for him, what they were? Right. He said they were basically a coping strategy, right? That if things got really bad, he always had suicide. That's one of the most important standings I've come to in my clinical work. If we can let people know that we get it, that we see that the thoughts of suicide they're having is something helpful in a way. As Craig said recently as part of a talk he was giving here in Massachusetts, it's not that he wanted to die, it was that he was willing to die. And his early experiences with mental health providers, yeah, right, not so good, were they? What did he say he was looking for? Yeah, he wanted someone to listen to him. He wanted to be heard. It sounds like he perceived clinicians as rushing to give him coping suggestions, such as the rubber band that you heard him say about, or to diagnose it, right? What else stands out for you? If you can think of other things, please jot those down. All right, let's move on to some statistics about suicide. This chart represents information from an annual federal survey. It's the National Survey of Drug Use and Health. And among many of the questions they ask people from every state and Puerto Rico are questions specific to mental health and to suicide. Based on their data, we can extrapolate that over 12 million people a year have had thoughts of suicide. Now, do you find that as astonishing as I do? 12 million people. That says a couple of things to me. First is that is not so unusual. People often tell us they don't want to share that they've been thinking about suicide or having these thoughts because they worry that others will think that they're crazy or that no one else will get it. Yet, if we can let people know that millions of people a year have thought of suicide, it makes it a bit more universal. Now, it's not that we're condoning suicide, it's that we're saying that it's not so unusual to have those thoughts about it, right? The second message I take away from this data is that if we could help people feel more comfortable talking about those thoughts, then perhaps we could stop that progression from thinking about suicide to acting on those thoughts, right? In the US, in the last year for which we have data, 2020, over 45,000 people died by suicide. This number and the rate per 100,000 have slightly decreased after 2 decades of increases. Another thing this chart reminds me is that not everyone who has thought about suicide is going to act on those thoughts. So clearly we can't be rushing everyone who's thought of suicide off to a hospital. These numbers also tell us that suicide is a major public health issue nationally. And it's important when we're talking about suicide to remind people that suicide is always complex. It's a perfect storm, if you will, of underlying issues, experiences, risk factors coming together to create a crisis for someone. Often we hear that suicide was the result of an event, that someone was arrested, they killed them, and they killed themselves. They broke up in a relationship, they were being bullied. But in fact, those single cause stories are actually a dangerous narrative. They give the message that people who are bullied kill themselves, which is not the story we want to be conveying. We'll be talking more about this later, about ways we can message well.